symptoms than the unvaccinated, including being hospitalized and dying. At this point, vaccination does not decrease infection rates and increases risks of serious cases. So this is some pretty serious analysis. As I said earlier, we're giving these scientists the opportunity to speak out with the warnings that they're making. We've got more interviews to come, including with the former head of French vaccine policy, Professor Perron. David.
Yeah, just to emphasise this point that Harvey Seligman was making on children, this was generated from his analysis of a huge pool of data from all across Europe, including the UK and Israel. And he was finding that as the vaccine programme rolled out, in most age groups, there was an initial harm caused as the immune system was suppressed and death rates. He was looking at all-cause mortality. Death rates went up, and then there would be a reduction in a period where the vaccine would be beneficial. And the one group that wasn't included in this was children who had not been vaccinated because they're too young for the vaccination programs. They were showing an increase in mortality stretching out, as he says, at 18 weeks. And the increase was something like 10% of all-cause mortality. So significant and very worrying and not fully explained. He suggests a few reasons why this might occur, but the causal link is not known. There may be more than one, but the statistical signature of this is very pronounced.
Okay, David, thank you very much for that.
Okay, let's move on then, because of course this whole anti-vax movement is in fact Russian-supported and Russian-driven. That is, if you believe the BBC. So the headline yesterday was the YouTubers who blew the whistle on an anti-vax plot. And they're saying a mysterious marketing agency secretly offered to pay social media stars to spread disinformation about COVID-19 vaccines. Their plan failed when the influencers went public about the attempt to recruit them. It started with an email, says one German YouTuber. And he normally ignores offers from brands asking him to advertise their product, says the BBC, to his 1.5 million subscribers. But the sponsorship offer he received in May was unlike any other. So they say an influencer marketing agency called Faza had offered to pay him to promote what he said was leaked information that suggested the death rate amongst people who had the Pfizer vaccine was almost 3 times that of the AstraZeneca jab. Well, actually, if you look at the MHRA yellow card statistics, and the latest data is on the yellowcard.ukcolumn.org website, if you look at that carefully, you'll see that for those that had an adverse reaction, so I'm not talking about everybody vaccinated, but for those that had an adverse reaction, it is probably 3 times more likely that that result is going to result in death based on those statistics if you had Pfizer over AstraZeneca, but that's beside the point. Let's move on, because here is one of the social media influencers, the German Mirko. He was offered money to spread disinformation on his social media accounts, says the BBC. And here's another one, a French gentleman called Leo Grasset, who was horrified by the attempt to recruit him. So who is it that was pushing this? Well, it's this organization here, Fazi. Start monetizing your individuality, and you can click on a box on a button that says I'm a blogger, and you can click on a button that says I'm an advertiser, and you can get together. It's all fantastic stuff. This, however, was originally pushed out by The Guardian and others, and quite a number of other mainstream news programs, platforms in May. So first question is, why has the BBC decided to carry this now? I'm not entirely clear. This is The Guardian from May. Influencers say Russian-linked PR agency asked them to disparage Pfizer vaccine. And here's the France 24 coverage. France hit by mystery campaign to discredit Pfizer. Now, the main organization that put out details on who's behind this alleged plot was this one, Radio Free Europe. Now, anybody that's any doubt about what this organization is, they began their career CIA-backed. They are absolutely backed by Western governments, and they push out an anti-Russian narrative. This is, I'm going to say, very similar to what might otherwise be termed an integrity initiative exercise, as we'll see. So this was an exclusive in Radio Free Europe. Meet the murky Russian network behind an anti-Pfizer disinformation drive in Europe. And again, this was published in March. And what the article says is, however, after all their various tenuous links between people, they have to admit, though no evidence has turned up suggesting the involvement of Russian public entities or government officials or agencies in the social media campaign, the effort has echoes of other PR efforts conducted by RDIF. Now, RDIF is the Russian Direct Investment Fund. It's a sovereign wealth fund. They are claiming some kind of echo. I don't know where the echo has come from, but they're claiming some kind of echo as the basis for the entire claim here that it was the Russians. So, David, I don't know what you think of that, but are you Russian-backed?
No, but the BBC is an echo chamber, so maybe they were attracted by the use of the word echo.
Yeah, it may well be. Now, just so that you know, the Radio Free Europe is funded by Western governments. Their annual budget is $124 million. So that's the kind of output you get from a $124 million per year funded organization. Yes.
I find the lack of value in the propaganda world quite remarkable.
Yes, indeed. Where does that take us?
It's almost as if they're not really very good at it, not very competent.
Well, if you live in a world of lies, it's difficult to know where to start once you get into work, I presume.
But David, the Mail yesterday or today had this article, who are the people dying of COVID now? There's a totally new kind of patient, says doctors, in their 40s, previously well, but unvaccinated.
Yeah, now I've got a couple of examples of this from the UK. America is just awash with articles like this, some of them extremely vicious. This is a PR campaign. Now, what the Mail goes on to say is, and this is completely unrelated to the headline, perhaps the most worrying was the latest Public Health England data showing that more vaccinated people, on average, are dying from the disease compared to those who are unjabbed. Is something going wrong? How much risk are we at despite having had our jabs? So they are doing now a hit piece on Public Health England's own data that says more people who are vaccinated are dying from COVID than people who are unvaccinated and dying from COVID, which, at least on the surface of it, is a statistic that warrants further investigation. So what does the Mail do? It doesn't investigate the statistics. It doesn't look at the data. It doesn't do any of those. It trots off to find anecdotal evidence to contradict the data that they have just announced. Right? So they then go on to, I've got a couple of examples in a long article with lots of examples. They talk about 35-year-old Carla Hodges from Hertfordshire, whose stepfather, Leslie Lawrenson, died aged 58 in early July, having contracted the virus weeks earlier. Leslie, a solicitor, had no underlying health conditions, but didn't have his vaccine because he believed he didn't need it. It's all done in this sort of tone. He was convinced because he was healthy and without any problems, it would be too bad for him, says Carla, an account manager. He didn't realise how sick he was. One minute he felt like he had a bad flu and was sitting up in bed working. The next minute he'd passed away in his bed. So we've got a series of individual anecdotes to make you believe that the data that they have just announced, which is true, that more people are dying from COVID if they're vaccinated than are dying from COVID if they're not vaccinated, in accordance with the Public Health England stats, to make you believe that that's not true. It's a bizarre article. They're saying we're going to investigate this statistic, and then they simply go and find anecdote after anecdote to refute the statistic, even though they admit the statistic is true.
David, if I just come in very quickly, I'm just fascinated by this story. But of course, what the Daily Mail is doing is using applied psychology. It's using the emotional text in the article to try and counter factual data information from Public Health England. this is applied psychology, it's nudging, and the Daily Mail absolutely knows that what it's doing here is trying to manipulate people's minds without most of them realizing what's happening.
David, we're already running behind time, but let's move on. Daily COVID deaths in Sweden hit zero as other nations brace for more lockdowns.
Well, Sweden continues to be the nation that dare not speak its name at the moment, because the Guardian told us that it was a catastrophe in the making. The fact that Sweden wasn't locking down, this was just going to be horrendous. And now they've got no deaths and they're pretty much open for business and tourists are going there. It's fallen to the Foundation for Economic Education to report on this. They're talking about a 7-day rolling average for COVID deaths was zero, nada, nothing. It's been zero for a week. And they conclude, as much of the world remains gripped in fear and nations devise new restrictions to curtail basic freedoms, Sweden remains a vital and shining reminder that there is a better way. And of course, you don't get that sort of reporting in the mainstream media.
No, and we've got a tweet here from John Miltimore basically saying the same thing.
Yeah, they're talking about how this is a Guardian piece there, how Sweden becomes an example of how not to handle COVID-19 and how terrible it's going to be, and yet they are at zero deaths.
But in the meantime, around the world, extensions of lockdowns.
Yes, here we go to Straits Times from Singapore. Indonesia extends COVID-19 lockdown set to ramp up contact tracing. And I love here they've picked a photograph of a funeral, and not only are the pallbearers in hazmat suits, but the coffin is wrapped in tarpaulin, because that's just how dangerous this all is. And they go on to explain that we're going to have non-essential workers restricted. They're going to be forced to work from home. We're going to have centralised quarantine facilities. And they say we want to make each centralised isolation location to have ample medical equipment, doctors and nurses and food. Otherwise, people do not want to come. The military chief was quoted as saying, so we're running out the military. The military are now running the delivery of medical services because it's that bad a crisis. That's the way the message that's been put forward by the Indonesian government. It's all one of panic, of extreme measures, of unusual measures, of lockdown restrictions and liberty, and it's necessary because of the terrible risk of COVID. Meanwhile, in Sweden, they're busy proving that this is not so.
Indeed. Now, coming back to the UK then, at the weekend, of course, there was a demonstration in London. It was held in Trafalgar Square, a number of speakers speaking at that. I have to say that the feedback that we've had about the day so far has been mixed. Some people thought it was very good. Some people didn't think it was so good as well. And I think the main problem with the people that didn't enjoy it quite so much or didn't think it was quite so effective was that they felt that having a group of people speaking on a stage, talking to an audience wasn't as effective as actually them walking with the audience through the streets of London and making, as a unified statement, making that statement absolutely clear. So that took place, a number of people speaking, but of course, as we'll see in 1 second, the BBC didn't manage to cover it on Saturday, but they did manage to attack some of the speakers. So any thoughts?
Well, I think there's more discussion to be had on the day. And yeah, what more can we say? We've had both opinions. We've had people that really enjoyed it and got a lot out of being with other like-minded people. And some people said, well, we weren't so keen because it was sort of all about the view from the stage and not about the opinion of the people attending. So we weren't there. We're going to have a deeper look at the comments from you.
And as I say, the BBC, of course, attacking people that were speaking, but what they didn't do was report it on the day. And in fact, BBC London, this was their only report of it on the day, that there was severe disruption on the A40 London westbound. queues on the A40 Oxford Street westbound in the West End around Marble Arch.